Presenter is going to be Dr. Raghid Bitar. They'll be talking about mortality risk associated with insurance denials in bariatric surgery candidates.
Good afternoon. I would like to start with thanking the panel and sages excuse me, for allowing us to present our data today. I have nothing to disclose. As we all know, the prevalence of obesity in the United States has been on the rise over the past 2 decades. More than 1/3 of adult Americans are considered obese, and more than 5% of adult Americans are considered morbidly obese. If we look at the trends of obesity over the past 2 decades, one can clearly see that it has been exponentially rising. To take an example, in 1990, no states had obesity prevalence of more than 15%, and several states had obesity prevalence less than 10%. 9 years later, in 1999, you can see the colors are definitely getting darker there. And as of 2008, only one state had obesity prevalence of less than 20%. And several states have had the prevalence more than 30%. So over a period of less than 2 decades, you can see the numbers have been increasing dramatically. Now this had obviously led to the increase in the number of morbidly obese patients who qualify for bariatric surgery according to the NIH consensus criteria that were set in 1991. Unfortunately, not all of these patients who meet the criteria I just mentioned end up undergoing surgery. The reasons why these patients do not undergo surgery have been basically grouped under 3 major categories. The first one being patient preference, the second one being medical conditions of the patient, basically patients who were too ill medically to undergo surgery. And the third group is insurance-related issues. And this has been actually looked into, and it was found that insurance-related issues are the most common reason why patients who meet criteria for bariatric surgery do not end up undergoing surgery. Several studies have looked into this, and it's been reported that anywhere between 30 to almost up to 50% of morbidly obese patients are either denied coverage by their insurance carriers or do not meet the extensive list of prerequisites that is set by the insurance carriers. As we all know, morbid obesity has some inherent risks associated with it. It's well known that patients with a BMI of more than 30 kilograms per meter square have a 70% greater risk of death than patients with lower BMIs. In one study, it was found that mortality rate in morbidly obese patients who did not undergo surgery was found to be statistically significantly higher than patients who did undergo surgery. The numbers were 14 versus 3% mortality rate. Because of the inherent risk of morbid obesity, and because not all patients who are at risk end up undergoing surgery, we set about to define the mortality rate among those patients who meet criteria, medical and surgical criteria for bariatric surgery, but who were either declined insurance coverage or were delayed in the process. We performed a retrospective review at our institution of our bariatric database between June 2002 and December 2008. A total of 538 patients were identified. These were patients who passed through the initial screening processes at our program and basically came to the what we call the fellows preoperative clinic during the time frame mentioned. 424 patients came to operation, and we're going to refer to that group as the control group, keeping in mind that this is probably one of the very few incidences where the surgical group is a control group. 114 patients were denied coverage and ended up not undergoing surgery. Following IRB approval, patient identifiers were used to query the Social Security death index to assess whether patients were alive or dead as of August 10, 2009. And survival analysis with Kaplan-Meier curves was performed using SPSS, with log-rank test being used for statistical significance. The subject group and the control group were similar demographically. The majority of those patients were females. Mean age was 44.7 versus 45.9 years. The mean follow-up was 44.3 months for the subjects, which are in this case the non-operative patients, and 44.5 months for the controls, who are patients who did undergo surgery. 2 deaths happened in the subject group, and this accounts for a mortality rate of 1.75%, and this is the subject or the non-operative group. 12 deaths occurred in the surgery group. 3 of these happened within 30 days of operation, accounting for a perioperative mortality of about 0.7%. 9 patients died during extended follow-up. Looking at the cumulative survival curves, you can see we did not really find any significant difference in the 2 plots over the period of follow-up. So to conclude, about 1/5 of the patients who are seen in our program for consideration of bariatric surgery fail to achieve insurance approval and follow through with an operation. Among these, there was a 1.75% mortality rate over a mean follow-up period of 44 months. This was not statistically significant or statistically different from the risk in the surgical group of patients. Over time, those patients who did not undergo surgery because of insurance denials are expected to suffer increasing mortality, although our data do not yet demonstrate this separation in the survival curves. Thus, I think longitudinal studies are necessary to follow these patients up for a longer period of time to prove that. Thank you, and I'll open the floor for questions.